Cynthia Pizana came to the US from Mexico as a child with her mother, fleeing poverty and domestic abuse. Despite living in an equally impoverished and violent household with her mother's second husband once they got to the US, Pizana's aspirations were still sky high.
Because parents feed it into you, like, you're going to be a doctor, you're going to be a lawyer.
When Pizana wasn't helping her mother clean houses to save enough money to get out of that abusive marriage, she was studying to get into a good university, and was even chosen to represent her school in Washington, D.C. for a government expedition program. That was when her mother told her that she was not an American citizen.
All the dreams that you ever have are nothing. Because I wanted to be so much. I wanted to be a psychologist. That was my thing. I was going to be it. And how am I supposed to do it if I'm not even eligible for scholarships at all? It doesn't matter. So it's just pointless. Why go to school? Why do anything if you're just going to end up being some like cook at some sketchy restaurant or cleaning some rich person's house?
Pizana was accepted into a university, but she couldn't keep up with the fees and dropped out after a year and isn't planning to go back anytime soon. So she works as a Spanish interpreter and shares a house with friends in Las Cruces. According to a 2012 research paper by American behavior scientist, undocumented youth who discover their status in adolescence often struggle to stay motivated as they become aware of barriers to opportunity and the uncertainty of their future in the US or with their families. New Mexico State University family and child science professor Courtney Valancourt says the psychological impact of living undocumented goes even further and can adversely affect mental health.
There's those additional stressors of being separated from family. There's the stressors of kind of living in an ambiguous state where you're not exactly sure what's going to happen. You may not have, plans for the future. You can't plan because you don't know what's going to happen. So certainly there would be an increased risk for depression, anxiety, things like that.
When Pizana was 19 years old, she was diagnosed with schizoaffective disorder, which she says is basically schizophrenia, depression, and anxiety all rolled into one.
The biggest issue is the hallucinations, because it trips you out when you're walking in the dark from home and you suddenly see this demonic figure or this creepy guy just like staring at you and you're like, are they there or not?
The precise biological environmental causes of schizoaffective disorder are not fully understood, but are believed to be a combination of genetics and early exposure to detrimental social environments and high-stress conditions growing up. Pizana says she has to take as many as 6 different medications to keep on top of it, medications that she wouldn't be able to afford if she stopped working full-time and went back to college.
Those are expensive medications. And I get help from my work because I get really good insurance and my insurance covers most of it.
President Obama's executive action in 2012 to provide relief to some children who came to the US illegally gave Pizana the papers she needed to get a full-time job with healthcare benefits, along with protection from deportation. But that protection is not long-term. Pizana's greatest anxiety is what the future holds for her and her mixed immigration status family once that temporary relief expires.
I don't really like to think about it.
Pizana doesn't want to get sent back to a country she can't even remember and is worried about the cost and accessibility of mental health care and the stigma attached to mental illness in Mexico.
It can either go 2 ways. Either you're possessed by Satan, which is pretty wild and colorful, I guess, or you're one of those crazy people in the corner that end up drinking to drown out your issues. It's not frequent that, people get the treatment that they should. It's a very hush-hush situation. People don't talk about it or get treated. They ignore it.
Despite the higher psychiatric risk factors associated with being undocumented, studies show the available mental health services are underutilized by those living in the United States without legal status. Pizana accesses help thanks to President Obama's relief, and those services are crucial. The Mayo Clinic notes people with schizoaffective disorder are at an increased risk for significant health problems, substance abuse, and suicide. For KRWG, I'm Simon Thompson.